Welcome to the RN Mentor Podcast. I'm Dr. Ali Tayeb, nurse, educator, advocate, and United States Navy veteran. This show is about real conversations with nurses moving the profession forward. We discuss leadership, practice, policy, research, and more. What matters and why it matters. I'm glad you're here, so let's get started. Hello, and welcome to another episode of the RN Mentor Podcast. I am super delighted to be joined today by Dr. Sherri Johnson. Dr. Johnson is a nationally recognized leader in workforce innovation, healthcare, and education. As Director of Partnership Development at Stride Inc., she supports over 60,000 middle and high school students nationwide, building academic and career pathways that connect young people to meaningful future in healthcare, public health, and beyond. With over 25 years of experience as a nurse leader, Dr. Johnson founded the Johnson Consulting Group and the Institute for Health and Social Equity. Dr. Johnson earned her Bachelor's of Science in Nursing from Hampton University, a Master's of Public Administration in Health Policy from Seton Hall University, a Post-Baccalaureate Certificate in Midwifery from Rutgers University, and a Doctor of Nursing Practice from the Johns Hopkins University School of Nursing. She is also a 2022 Education Policy Fellow with the Institute for Educational Leadership in Washington, D.C. In recognition of her contributions, Dr. Johnson was inducted as a Fellow of the American Academy of Nursing in 2023 and a Fellow of the Academy of Diversity Leaders in Nursing of the National Black Nurses Association. Dr. Johnson is also the author of I See You, a faith-based guide for emerging leaders, scheduled for release in June of 2025. Welcome to the show, Dr. Johnson. And for my guest, I was just making sure I made her bio shorter for her full bio because she is very well accomplished. Will be on the website for you to take a look at. So again, welcome to the show, Dr. Johnson.
Oh, thank you so much, Ali, for having me.
This is exciting. You and I have known each other for a few years. We were,
Yes.
as we were discussing it before we started recording, we got inducted into the academy the
Yes.
same year. So again, congratulations on that. But let's get started with my first question is how did you find yourself in the world of nursing?
Well, I came from a line of nurses in my family. So my grandmother was a licensed vocational nurse in the 50s. Great grandmother was a midwife. My aunt was a nurse. I have cousins that are nurses. But most importantly, nursing has always been a calling for me. And it was cemented in high school when I participated in a group called the Medical Explorers, and we got to shadow different members of the healthcare team. I shadowed a nurse, a perioperative nurse, and she really impacted me in terms of how she related to the patient, and the whole patient and the family. And at that point, um, it was validated for me, that I was to become a nurse.
Yeah,
So
that's awesome. Genetic. It was genetics.
yes, yeah, it was genetics.
That's incredible. Wow. So tell me a little bit about I guess I want to know how that influence of having a few generations of nurses in your family influence you. Like, what did you see them do that you're like, huh, that might be a career for me?
Yes, well, my grandmother, I would spend summers with my grandmother, and she would always um, bring out these pictures of when she was a nurse, and she worked with TB patients.
Oh, wow.
She had pictures of herself standing by an iron lung, if you will, and I was just so fascinated by her stories and just the whole journey. And it just really resonated with me in terms of um, caring for those that have been on the margins.
Yeah.
Just think that's just part of our, part of nursing's DNA, really, and so that really resonated with me.
Wow, that's incredible. So you were in high school and you said, okay, I'm going to go into the world of nursing. Um, how did you proceed? Like, what was your college experience like?
Oh, sure. So yes, I went to a Catholic school, K through 12, and there weren't many students that looked like me,
Mm,
and so I really wanted my college experience to be a little different, and so both of my parents had gone to HBCUs, and I went on a college tour. He took me to several colleges, and I landed at Hampton University. Just the nurturing environment of the professors and the small size classes. And I just felt, wow, yes, this is it for me, Hampton University. And it was the best 4 years of my life in nursing school. One of the hardest I would say. And graduated from Hampton and began my career as a visiting nurse. I really wanted to be out in the community serving
nice.
patients. So yes, so that's what my
Yeah.
college experience looked like.
Wow, very cool. Now, I don't want to like turn the conversation because I want to make sure I focus on you. But having gone to Hampton University, how important is that kind of environment for what I would say like minoritized populations who don't necessarily see
Yes.
themselves in certain career fields or in a university, um, and not having that support system in place. I've had a couple of guests who've spoken about that before, but from your experience, how important was that for your success moving forward?
I believe it was so important for my success. It was really um, really confirming my identity, if you will, as an African American student.
Mm,
And the campus, just to see professors, professors, that are African American. Well, we had a diverse faculty, but to see these Black faculty members at the highest levels in nursing and in all types of academic fields was just so inspiring. And to be able to learn about our history and where we came from, and the fact that professors really cared about you, whether you showed up in class or not, they would be looking for you. And so that was
yeah,
very quite different, from what I had experienced, at other institutions. And that really meant a lot. And students coming from all over the world, all socioeconomic and geographic backgrounds. And so it was just really essential to my identity, as a young Black student coming up. And it did so much for me. I felt as though when I graduated, I could do anything. And I have to say that was my first introduction to the academy, was when I was in nursing school. Several of my professors were fellows at that time. I
wow,
didn't know what it was. I knew it was something big. And then it was not until our dean at that time was inducted, and she shared pictures and really talked about what it meant. And she was in tears talking about it. And at that,
yeah,
I was just, that was my, introduction into the academy. And so just to have these images and these real life, you know, um, groundbreaking nurses, in my presence while I was matriculating, just really made all the difference.
yeah, that's amazing. I'm surprised how many nurses, again, sorry, my ADHD kicks in and I go on these
No
tangents.
worries.
I'm surprised how many individuals within the profession of nursing are not aware of the academy. Like I make it a point in when I was teaching my leadership courses is to bring up the academy because um, I had my students reach out to fellows of the academy and do an interview with them to look at their same thing I'm doing actually with this podcast. And actually this
Yes.
podcast was a result of the pandemic taking away that resource for me in my classes. But talking to individuals that were because they can look at the career trajectories, right? Which usually expand beyond the four walls of the hospitals, which we
Yes.
embed into them throughout their entire pre-licensure career. So so I'm surprised how many nurses are just not aware of the academy, the work of the academy. Um, and so I'm glad that you had that exposure early on.
Yes, yes. And it really it resonated with me because I said to myself, now, fast forward to where we are in present day, I think it's important to really expose and have those conversations about professional organizations and advancing nursing early in the nursing
Yeah,
education curriculum. So I think that there's definitely some opportunities for us in nursing education to look at that and really see how we can embed those components in the nursing program.
yeah, I definitely agree with that. I want to get back to talking about your career a bit more. So I saw your master's degree was actually in um, uh, public administration in health policy. How did you
Yes.
go from being an individual that was working in the community to that policy piece? What was that shift for you?
Yes, well, advocacy and policy was always part of me and what I did. Even in high school, I was part of many community organizations, volunteerism. Um, my dad had really been active in local politics, and so it's just part of my DNA to pursue that. I looked at the MSN and I was looking at various master's degree programs, and I wanted something that was broad,
Yeah.
looking at my career strategically. And so I chose the Master Public Administration program at Seton Hall, and it was amazing. And I earned a scholarship actually with the Veterans Administration, where
Oh,
I
nice.
administrative resident there working for the hospital director in New Jersey. And that scholarship paid for my education, the VA, my master's program. And I really got to work on a lot of significant projects. And so veterans health is also very near and dear to me. I have family members in the military, and so that was my first immersion, if you will, in public administration and policy was at the VA. And I was able to complete the MPA program. And I would always, wherever I worked, I knew that I was going to be intentional about embedding, policy and advocacy somehow
Yeah.
in my nursing career.
Wow, that's amazing. How did you, what was your, because I'm looking, as you're talking about this, I'm like, when I looked at my master's program, the thought of doing anything outside of nursing was not even there.
Mhm.
Like my brain hadn't had that exposure. As a result, those neurons did not connect that you could do something outside of nursing. How did you? Like, what was that component for you that said, "Oh, I could do something outside of nursing. My master's degree can be something different."
Sure. Yeah, I always it's just how my mind works. I think very broadly, and I wanted a master's program that was going to be a broad
Yeah,
focus. And so um I said, I'm going to step out of the box. I'm going to pursue something a little different. And I could always come back, if I wanted to
yeah,
and get an MSN. but I think it's just my approach in really wanting to step in places where might be a bit different. I believe that, those environments and those opportunities also lend itself to tremendous growth. And I just wanted to learn. I wanted to be exposed, and it was just an amazing program.
Yeah, that's great. How did that program affect the the kind of nurse you were and the impact you made in the profession of nursing? How did that program sort of guide you or supplement that for you?
Thank you for that question. I think it's supplemented in a few ways. The first was the ability to collaborate across disciplines, because I was the only nurse in my MPA program. So that within itself lent itself to me really working with other professionals, that were of different disciplines. Some were, attorneys. Some were, working for other areas of government, and to be able to work together and innovate. I think that the ability to sharpen my skills in the collaboration piece across disciplines really, really helped, with
Mm,
program. And then also regarding the policy process, because I would then go on and be very active in my nurses associations with regard to advocacy. So the MPA program helped as it relates to the collaborative piece, and also in terms of learning about the policy process, how that works, and leveraging my foundation as a nurse to advocate for patients and for healthcare as a whole.
yeah, I think that's I mean, as you're sharing this with me, I'm trying to think of how we do that in some of our nursing programs, and I don't think we do the best job in our nursing programs to add that into the clinical stuff that we see in a lot of the master's programs. I wish we
Hmm.
did a better
Hmm.
job at that. Just some of the I know of multiple programs, and like they may have a course or something like that in there, or it may be part of a little tiny sliver of another program, but we just don't do a good enough job like in our undergraduate and our master's programs. Like that's just not a focus, and I
Yeah.
wish it was a bigger focus because
Yeah.
4 5 billion of us now, and we're just not leveraging um, those numbers.
I agree with you. And that was what I found as I was researching various master's programs. I was just looking for something that was, um, again, spoke to those pieces. And I didn't see it within the traditional, MSN program.
Yeah,
So
it's interesting. Um, Now you went back for your post-bac midwifery certificate.
I did.
What was that about?
Yes. Um, I women's health is my joy, my love, my passion, and I actually wanted to work in labor and delivery right out of nursing school. But back in the day, and I'm dating myself, you could not, you had to work med surge first, and then
Yes.
wait till somebody retires in labor and delivery, and so and I said, wow, I really want to help women. I really want to be a midwife. I have, midwifery like you said, in my DNA. And at that time in the late 90s, there was actually a surplus of nurses. And so the nursing profession at that time, the market was so saturated with nurses where you could not find a job if that really, make sense, but you couldn't. And so I found a role that accepted new graduates that were interested in public health, community health, and they accepted new BSN students. And so I was accepted into that program as my first job. And I would take pediatric cases and women's health cases, in the interim. And then later on, I was hired as a labor and delivery nurse a few years later after that, and then applied for my midwifery post-bac certificate. And it was an amazing experience. I had to deliver, I think, about 50 babies as part of the competency and to graduate. And life after graduation, life took me in a different direction, and I was recruited to run a women and children's service at a hospital. And
Oh,
so when I look back at my personal statement for entry into the midwifery program, it specifically said that I want to advocate for women. I want to understand what the business of women's health looks like. So I was able to accomplish that. And, I really want to impact women's health from a policy perspective. So those were the three things that I put in my letter, and it all worked out. But life took me into a different direction. And so I did not practice midwifery, although I did graduate from the program. I went on to lead various women's health programs throughout my career.
well, you did 50 deliveries as part of the competency. I would say you practiced.
Yeah, that is true. Yes.
That's 49 more than me, so and mine was completely by accident, not as part of a competency.
Oh, that's amazing. That is amazing.
Yeah. So this is all fascinating. I want to kind of fast forward you. Yeah, it may not be a fast forward at all. You created two different or multiple different organizations.
Mhm.
What took you from doing sort of like direct care leadership policy into this other arena of creating um, your like sort of like nonprofits and the kind of the
Mhm.
business end of the nursing world? What took you from one to the other?
Yes. It was only a matter of time. I wanted to do it earlier, and then but timing is everything, right? And so in 2016, I founded my nonprofit organization, the Institute for Health and Social Equity. And it was born out of really wanting to impact health disparities. I grew up in New Jersey, which is the most densely populated state in the country, and where you can visibly see, um, the difference in the zip codes in a matter of a couple blocks.
Wow.
So yes, and it really impacted me growing up, and navigating through those spaces, and education and healthcare stuck with me, as a child, and growing up. And I said, I want to do something about this. And um, when I became a visiting nurse, I worked directly, with patients in the community, from all types of backgrounds. What was most profound was my first assignment was in Newark, New Jersey, and um, I was a part of a group of nurses who provided care in what used to be known as the Prince Street project building. Those buildings are no longer there, but we had to go with armed security at that time. We had
Oh,
to
wow.
escorts into those buildings, and we would provide, whether it was diabetic care or maternal child care, in those buildings. And But I was able to really gain the trust of the community. They saw me there coming every week and, got to know me, and I became part of that, that community. And I remember saying, this is not fair. I want to do something about this. Why is it that, I can start my day, you know, in this, you know, um, part of New Jersey, and then, the next case could be 20 minutes away in a very affluent area, and the care should not be any different, you know?
Right.
And so, anyway, that's what led me to found the Institute for Health and Social Equity, to really invest in the future nursing workforce. So, it's impacting health disparities by investing in students who are pursuing degrees in nursing, public health, other STEM fields, medicine, and we provide scholarships and mentoring for those students. And, you know, as you already know the data as it relates to having a more diverse nursing workforce, in terms of the outcomes and the care outcomes. So I really wanted to be part of that. It takes a lot more, but we are one of many, and I wanted to be part of the solution. So that was the impetus for
Mm.
Institute for Health and Social Equity. And then I founded my consulting company in 2014, because I was starting to get inquiries on, um, community community development strategies, community outreach strategies, and so, that's also part of my competency as well. I do work in that area, and so really working with mission-driven organizations, to create programs and help develop partnerships in those areas.
That's great. Thank you for that. I want to go back to the workforce piece because, yes, we don't have the diversity we need within the workforce. And so many of the interventions we see these days, like they happen like after high school, or they happen like the resources are put into like college level of trying to oh, we'll do recruiting, we'll do this, we'll do, our recruiting methodologies are going to be in a way where we're going to be more diverse or whatever, right? And I feel like I always tell people, I feel like that's too late because your pool of candidates are not going to be that diverse, right? And that's
Yes,
that's an issue
that's right.
because so you need to start much earlier, like junior high school, middle school, high
Hmm.
school
Hmm.
is where you really need to invest to make sure you have a diverse pool of candidates trying to get into the nursing program, right?
Yeah.
So that's my opinion. So how
Oh,
has your
agree.
how has your experience like either validated that or said this is where resources need to go?
Oh, I agree with you 1,000%, Ali. And I believe we need to be looking, as a profession, we need to be looking like 20 years out in terms of our planning, for the next generations
Yeah.
of nurses. So part of that planning, to your point, is um, exploration and education as early as possible,
Mm.
even in primary education, to really start exposing students to what's possible and what can be,
Yeah.
those early images. Um, but I and also we need to incorporate curriculum in high school and middle school and high school, whereby students can earn, for example, certifications and dual enrollment, and start taking classes towards nursing if that's what they choose. I also think it's important to prepare students with in the sciences and the math and all of the courses that will be needed for success in nursing programs. many students from communities that have been marginalized, you know, the attrition rate is much higher.
Mm,
And then when you correlate that with those prerequisite courses, there is a relationship there. So I think it's also the preparation that goes into success for nurses
right.
very early. So I'm happy to be part of that. I work in that space about uh, 5 years ago, right after COVID. I began working at an ed tech company, and at that time, I was hired to help to build out the national health science pathways for several schools across the country for thousands of students. And these were students who were interested in nursing and other health related professions. And I was able to help to build out those pathways for students who are now, pursuing careers in nursing and other health related pathways. So, but I
Right.
think it's important. Um, I thought during COVID, because of the negative images that the media had portrayed about nursing,
Mm,
that may have had an impact on students wanting to come into the profession, but it was actually quite the opposite. There was so much of a demand for students who were still interested, and that just really, warmed my heart to see that, and
yeah.
yeah, continue to build on that.
Now, going off of that same theme, um, what do you think the profession of nursing needs to do better in engaging? Because I feel like as a profession, we're not really engaging like
Mhm.
the uh, primary schools or middle or high schools. We're not really there. Like we don't have
Mhm.
a presence where I feel like other professions, especially like physicians and things like
Oh
that,
yeah.
have a presence. That's my first part. And then second part, is there I think I know the answer to this. Is there a funding disparity between programs that fund for physician recruitment versus nursing recruitment?
Yes, thank you for that question. I think what we need to be doing um, as a profession really is partnering with schools. We need to partner with schools and to simply provide exposure to nursing and what it is, and potentially provide exploration programs. I think if we can connect with primary schools as a profession, um, that really helps in terms of really the planning. We need, again, I think we should be looking 20 years out,
Yeah.
in terms of recruitment and really developing strategies and tactics to do that. And that's not a 3 or 4 year plan. To your point, it's something we have to start much earlier. And in terms of the funding, yes, I've seen funding disparities there as well. So when you look at the medical profession and also STEM, which I do believe nursing is STEM. So
Right.
I think we have a ways to go with that, but nursing should be included in STEM because we take many of the same courses um, and prerequisites. So that's, I'll put a pin in that and come back. But when you look at historically, when you look at STEM funding, um, nursing is not included in that.
Mm,
But you do have funding for students in primary and secondary schools and secondary programs to go into the STEM fields. Um, which includes medicine as well. So I believe that there's definitely some opportunity there for advocacy in terms of the funding to increase our diverse pool of candidates, in nursing.
Yeah, I agree. I know of one particular institution that has like a pre-health program, like a summer pre-health program, but they don't include nursing in that,
Yeah,
which is quite interesting. And it has to do with their funding. And I'm like, what?
right.
Like it's a
Exactly.
pre-health program,
Yeah.
but nursing is not. They don't have a. They don't. It's not inclusive of anybody interested in pursuing a nursing degree,
No.
which is quite interesting.
Yeah.
Uh,
And you also see there are many organizations in it, but it's happening in pockets that
yeah,
are doing things to really attract young people to the profession. But just imagine, as a profession, if we incorporated that as a whole, just as part of, what we do,
yeah,
imagine, where we would be. So, I think there's definitely some opportunity there for us.
yeah. I agree. I want to go back to what a statement that she made regarding nursing as a profession partnering with schools.
Mhm.
And I'm going to put you a little bit on the spot. Who in the nursing profession should be doing that? Should it be, because if I just, if I say, oh, I think A&A needs to do it or whoever else needs to do it, it's not going to get done. It's like too, like in my head, I imagine like it's going to be various organizations.
Oh, yeah.
But like when you say, how do you operationalize something like that, that partnership? Because me as an individual, like when my kids were in pre-K, like I went and I did a talk for them and stuff like that, right? On like career days and things like that. But that was me as an individual doing something like that. But you need something more structured, I feel
Mhm.
like, for this long-term recruitment. Who should be doing that? Like who should be
Oh,
organizing us as a profession?
oh, I totally agree with you. So, yes, it should be the organization, professional organizations, and some of our professional organizations are already doing it. Like I know the National Black Nurses Association has the Mini Nurse Academy,
Right.
and there's others. But to your point, how can we, make that? How can we operationalize that as a whole? I think it's to me, it's policy. You know, I think if we can advocate for funding and programs that are embedded in nursing related funding, just like the STEM programs are, um, that it's part of the culture. It's part of the STEM culture, right? Where the profession, the that industry is reaching out to young people, and I think that and there is federal funding for that. So I think from a policy perspective, there's opportunity to advocate in that particular area as well.
But not to throw it on to, that whole idea of volunteering, because I think as it is, we volunteer for way too much. Like we put a lot of energy into things that don't pay us necessarily for our time,
Mhm.
as part of our professional obligation. But yeah, as you were mentioning that, I thought, what a great way for for this to be like a hash, like sort of a asterisk for a lot of organizations, like for like Sigma chapters, for like the different nursing association chapters that are within certain areas, within the Student Nurses Association. That could be a another thing for their local chapters to have like these
Absolutely.
things built in. But I still think like somebody at top echelon needs to say, here's the messaging we want to share with every school, right? So the messaging needs to be consistent as opposed to sort of a show and tell. And so much of the show and tell always ends up being like, oh, look, we do IVs and we do medication stuff and we
Right.
do, and you lose the bigger picture of what nursing is, right? It becomes more of a Grey's Anatomy kind of a thing where there are no nurses, in that show anyway. But
I
so
agree with you. Yeah, it needs to be a movement. And I remember years ago, Johnson and Johnson had
yeah,
a big campaign at one
yeah,
point. So something like that, where it's a movement, it's just our part of our culture and
Yeah.
what we do. So,
Yeah, I agree. Well, thank you. Thank you for all of this.
yeah.
I want to be cognizant of our time. Anything else you want to share? I feel like I can talk to you forever, but
Oh, absolutely. I would be remiss if I did not mention nurses shift change. And so nurses shift change, we recently had a rally a few weeks ago, and it was born out of the Stand Up for Science movement. It was founded by none other than Dr. Danielle McCamey, who is the president and CEO of DMPs of Color. And many nurses, including myself, became interested in that movement, and it's growing. It's really becoming a platform for advocacy that provides accessible entry points for any nurse of any title, any specialty, any organization to participate in the advocacy process. And Nurses Shift Change is not in any way in competition with any one organization. We really see ourselves as a platform for partnership, a platform for collaboration in advancing the future of nursing. It's founded um, on nursing principles,
yeah,
humanity, ethics, social justice, and science. It's the 75th anniversary, as you know, of the Nursing Code of Ethics, and that's what guides our work. And so we are planning next year during Nurses Week a Million Nurses March, and
beautiful.
you'll hear more about that to come. But we want every nurse to feel empowered to participate. LPNs, RNs, nurses that work at the bedside, nurses that work in education, nurses that work in non-traditional spaces. Now is the time. We are at a critical point, in healthcare, in nursing, and we need to use our voices to stand up and speak out.
Yeah, absolutely. Thank you for bringing that up. I've seen the social media posts on those, and they've been great and informative. And I know you guys were just in DC doing this.
Oh,
Um,
we're actually national. So yes, so many we're working with many organizations across the country. And so at the rally, we had California, we had
yeah,
Washington State, we had um Florida, Connecticut. We had nurses and organizations from across the country. So we're looking to grow that. We happen to be, in the DC area, but
yeah.
it's across geography.
Yeah. Now, do you have now? I know I saw like some partner organizations that were associated with you guys, or with the Nurses Shift Change. What's the platform? What's the other than engaging more nurses in the national like health advocacy?
Oh, absolutely. So we are right now, we have Medicaid and Medicare is on the chopping block. And as you know, those cuts impact um, not just nurses, but the
Yeah,
patients that we care for. And so it is so important that, this touches all of us. And it's so important that we speak out on it. Also Title VIII, and the nurses, the Institute for Nursing Research is on the
right.
chopping block as well. So we are advocating for reform in that area, and we have a full platform which is on the website, um, nursesshiftchange.org. But those are some of the major pieces that we're advocating for.
That's great. That's great. I'm gonna put Veterans Health in there too. Throw it in there as
Absolutely, yes.
they're greatly being impacted right now with some of the shenanigans going on in this
Mhm.
world. So So thank you. Yeah, thank you for bringing that up.
Yeah.
That's a great, fairly new movement that's
Yes.
happened. So thank you for bringing that up, and I'll make sure that I'm including that website
Thank you.
into this podcast. So if anybody's listening and wants to take a look at it, it's really a great work. And Dr. McCamey is moving it for or started and leading the charge on this, and I'm sure it's going to turn massive in a
Oh,
matter of
yes.
days. So thank you for that.
Yes.
All right. Anything else before I
No,
give you your time back?
just I want to thank you, Ali, for all of the work that you are doing
Oh, thank you.
to really invest into the future of nursing through the RN Mentor podcast and elevating the voice of nursing. And this is just
Thank you.
a wonderful platform. Thank you for your service
Oh, thank
to
you.
this country. And it's just been a pleasure to be part of your podcast.
I appreciate it. Thank you so much. And hopefully we'll run into each other soon.
Yes,
So we did a few months ago, I want
we
to say.
did.
Yeah,
Yes.
yeah, yeah.
Yeah.
So
Yeah. AONL. Yes.
AOL, yes. So fantastic. It was great to see you. Hopefully I'll see you again soon. And we have been listening to Dr. Sherri Johnson, and I am looking forward to bringing you more incredible colleagues as the weeks move forward. So thanks so much for joining. Bye-bye. Thanks for joining me on the RN Mentor Podcast, a production of RN Mentor Consulting. Please don't forget to follow and check out rnmentor.org for additional content, speakers, podcast notes, and more. Until next time, fair winds and following seas.